What I propose you is just to offer the floor to Antonella Cardone, because here we were representing the NGOs on this table, ENSP and ECPC, and I kindly ask Antonella to address her speech to the audience. Please, Antonella.
Thank you, Cornell. So you know that now that I work, I'm the director at the European Cancer Patient Coalition. So at ECPC, as the largest cancer patient umbrella organization in Europe, we appreciate that the Europe's Beating Cancer Plan focuses on the well-being and of patients and their families, because we consider that patient centricity, together with the key actions such as the improvement of health literacy, reduction of tobacco use, equal access to medicine and innovation, will effectively tackle the cancer burden across Europe. And if we all work together towards the same goal, we can all together help revert the dramatic trend of cancer becoming the leading cause of death in Europe. You all know that now cancer is the second leading cause of death after cardiovascular diseases. So there is considerable evidence that shows the effects and consequences that tobacco consumption has on cancer. And the Europe's Beating Cancer Plan is a step forward in the fight against the tobacco smoke, specifically as a cancer prevention strategy. It is well documented that tobacco smoke is strongly associated with a number of cancers, and not only lung cancer. Unfortunately, there is very little research on the impact of tobacco smoke on the promotion or distribution of the tumor in the body, and on the impact that tobacco smoke has on the treatment efficacy, on recurrence, toxicity, and mortality, and on the impact that tobacco smoke has on the value-based outcomes, like the cost of cancer treatment, quality of life, and productivity of cancer patients. These are all very important aspects to consider when managing cancer with a patient who smokes cigarettes. So the little available research shows that active smoking increases the susceptibility to common cancers in the general population, but also increases disease severity and comorbidities in cancer patients. In patients with cancer, continued tobacco use after diagnosis is associated with poor outcomes, including increased treatment-related toxicity, decreased quality of life, and survival. Evidence shows that cancer patients and their overall cancer treatment outcomes would benefit significantly if the patient quit smoking. $3.4 billion are spent annually on cancer drugs from treatment failures due to tobacco smoking. The entire economy would benefit from smoking cessation programs, and yet up to 50% of patients smoking before a cancer diagnosis continue to smoke during treatment, and the relapse rate is very high among those who quit. So smoking cessation interventions should be a relevant part of the standard oncologic treatment and could involve individual counseling, hospital or community-based programs. So the take-home messages from my intervention here are the following. Like, quitting smoking at diagnosis can improve cancer patients' treatment effectiveness, overall outcomes, and the quality of life of cancer patients. Cancer diagnosis may provide a useful turn point moment to support cancer patients to quit smoking. But this chance is frequently undervalued by the healthcare system. Inclusion of smoking cessation programs into standard care for cancer patients is too often overlooked, and there is a lack of support for cancer patients who are willing to quit. So the implementation of the Europe's Beating Cancer Plan should adequately addressing cessation. So to conclude, the Commission's plan indeed confirms an ambitious tobacco targets as part of its push to contain cancer mortality, with the goal of creating a tobacco-free generation by 2040 and less than 5% of the population tobacco user by 2040. At ECPC, we're pleased to see that the fight against cancer remains a top priority for the European Commission, despite the unprecedented reach and proportion of the coronavirus health crisis. However, despite seeing that Europe is on the right direction in order to end the rising burden of cancer, effective implementation of the plan is key. And we, together with the entire cancer community, are committed to support the execution of the plan. Thank you, Cornel.